Okay, those are good people over there on 447 Wilkett Street. Okay, again, Dr. Eileen George, take it away.
Thank you again for having me, Michael.
My pleasure. It's really an honor.
When Michael invited me to come and talk about my programs, the answer was immediate and swift, and I thought, an opportunity to brag? Who's going to pass that up, right? And I have great programs to brag about, so the pleasure really is all mine. I'd like to begin with just a little brief discussion about healthcare trends in terms of what the need is for the programs in my division. And the specific programs in my division are nursing, the physical therapist assistant program, of which Christine is a graduate of, the radiologic technology program, and the respiratory therapy program. And as we all know, Obamacare is around the corner, and we don't have that crystal ball. I don't think we've all figured out what it will mean for our healthcare partners. Our hospital partners are certainly very anxious about it. What we do know, whether you agree with Obamacare politically or not, what we all know is that millions of un- and underinsured individuals will now be able to receive healthcare services. And that's a good thing, politics aside, for the health of the country. What that means for us at Naugatuck Valley in the Allied Health and Nursing Division is that you're going to need providers to take care of all of those people as they now seek health care. So there is, in terms of future trends, there's going to be a tremendous need for graduates in all of our program, and that's not going away anytime soon. In addition, the focus now is on prevention as opposed to waiting till an individual develops a disease process. We are really focusing more on prevention, which is also a good thing for the health of this country and a real change in how we've approached healthcare traditionally.
Instead of wait until you're dying.
Exactly.
It's now be proactive.
About
wellness.
Diet and absolutely.
Sure, I'm all for that.
Yeah.
But it's got to be properly CPT coded, or it's not going to be covered, believe you me. I fought that at least once a week. What do you mean? She said she went for a checkup.
We're getting there. We're getting there.
We are.
And then, of course, there's the changing demographic. The very youngest of baby boomers are at an age now where they're beginning to receive health care services, and that's a trend that will continue. And as people live longer because of, the focus on prevention and better health in the country, there will be continued need for health care providers to take care of them. So all of our programs, I'm very proud to say, have extraordinary licensure pass rates well above the national average. And we also have great job placement rates. As Christina shared, most of her class had jobs before they even graduated, which is really outstanding. It was really heartwarming for me to sit and listen to Christina share her story about some emotional duress that she was under and how supportive the faculty was.
That's what really got me, too.
Yeah.
I mean, you actually almost teared up at one point talking during the break, during the board meeting, and you were saying, I had it a little tough, and I had to lean on my classmates and my teachers. It was a very heartfelt. That's why you're here. Nursing. $75,000. That's a phenomenal salary.
Yeah, and when you consider how cost-effective the community college is, it certainly you could not beat the return on investment, and you consider how good the job placement is as well. Our nurses, I meet with an advisory board with our practice partners, and our practice partners are very pleased with our graduates. They enjoy a very good reputation in the community, thankfully.
Right.
And we work very hard. We've earned that reputation.
Oh, you work very hard.
Yeah. And our graduates, we have lots of graduate success stories, too. I think I'm one of them. I'm very proud to say I'm a graduate of this program.
Excellent.
And
Alumni.
I was able to complete my advanced education to the doctoral level, but I credit a lot of that to a very solid foundation that I had in the community college.
And I remember you're sort of self-made, like you had to work through this and pay for it as you went. It wasn't just a quick 5-year thing, right?
No, it was many years.
Right. I remember.
It was many years in the process, yeah. My son was 14 months when I finished my bachelor's, and he was 5 when I finished my master's. And we graduated. He graduated high school at 18, and I graduated from the doctoral program that same year as well. So
you deserve all your success.
I think I've been a good example. At least I hope I have for him.
Sure.
So the salary ranges, as you indicated, for all the programs in the division are anywhere from $57,000 up to $75,000, and certainly the job need will continue to be there. In terms of the nursing program, there's some exciting things happening for us. One of the things that's happening is that we are piloting an LPN fast track program, and that was really in response to a community need. We were seeing that long-term care facilities were hiring more of our graduates, more RNs, and that was a work setting that had been predominantly LPN. And the LPNs were now being displaced from their jobs by our RN graduates. So in response to that community need, we developed a program where we could quickly move LPNs through to get their RNs and get jobs and get work. Historically, it would take an LPN anywhere from 18 months to the full 2 years to get through and get an RN degree. And now with the fast track, we can get them through in 12 months. And so that's exciting, direct response to a community need. And we have about a dozen articulation agreements. So it's very important for me to not only take care of the getting LPNs, their RNs quickly, but also on the other end, getting my RNs, their BSNs quickly. And so we have 12 articulation agreements that help with seamless progression into a bachelor's program. And some of our, I won't list them all. I know we don't have time.
We have plenty of time. Hold on.
But I will.
For those of you that want to call in, if you're new to the show and you're working somewhere and you really don't love Medicare, but this is exciting, the nursing stuff, and Dr. George, phone number is 203-757-1320 for any of you newbies. LPN stands for?
Licensed Practical Nurse.
Got it. Okay,
yeah,
so
sorry.
We all talk PPACA and ACA, and not everyone knows our terms. So LPN, do you go to the community college and then have to go to a 4-year university to get your RN?
The RN, the credential is the same. If someone started at a 4-year university for nursing and they graduated after 4 years, we sit for the same licensure exam. The credential is the same. They would have an RN. But you can, at the end of 2 years in an associate degree program, sit for licensure and obtain the same credential.
By just simply going to Naugatuck Valley Community College.
Correct. You would have
so
an
this
RN.
is totally doable
licensed.
for a lot of our listening public.
Yes.
I mean, it doesn't have to be the big, expensive schools. It can be your local, and it's on the bus line. Dr. Daisy touts that every board meeting. You could find a friend, ride a bicycle, take a moped. Don't just have an out. Don't just have an excuse where it's, I can't do this. Because right next to me, Christina did it, and its PTA degree is pretty sweet pay, too. Okay, so keep going.
Okay. So, the articulation agreements promote seamless progression for our graduates into bachelor's programs. Some of the partners, I just want to name a few so that you have a sense of who it is we have partnerships with. Some of the articulation agreements we have are with Yale University is one, Southern Connecticut State University, Western Connecticut State University, Central Connecticut State University, St. Joe's, Sacred Heart, just to name a few. So, those are all very fine
prestigious
schools, and we're working on one with UConn. So we're very excited.
And this
about
would be
that.
Dr. Pizzuto's UConn or Storrs?
This would be Dr. Pizzuto's.
Oh, sweet, Waterbury.
And I believe, I'm not even certain.
Whatever,
I believe
whatever.
So.
It's baby steps.
Yeah.
And next year when we're here again, you'll have done it, or 18 months. Sometimes it takes an army.
Yeah.
I hear you.
So, for all of our programs, I think Christina, again, is a shining example of the typical community college student. All of our students are struggling with multiple jobs. We have many students who are second and third career people. We have students who are juggling family responsibilities and work responsibilities, and I credit them so with juggling these very rigorous programs, as Christina will tell you, and she was being very nice. But the programs are not easy. They are competitive. They are challenging, and all of our programs do have wait lists. And I'm often asked what it is for the listeners you need to get into some of these programs, and I would say that generally you need to be very strong in the maths and sciences.
Right, and study.
And study
hard. Don't take it lightly. I tell people that all the time. Like, if it was this easy, everyone would be an insurance agent with a radio show with a, Kristen, my coworker's right now studying, and she said this is hard.
Yeah.
This is not. You just. I couldn't be a PTA in a month. I just couldn't. So I heard these other programs are really popular as well. The respiratory therapy program.
The respiratory therapy
and your
program.
Radiology program. You call it differently. You have another word for it.
The radiologic technology
That's
program.
It. Yeah. Don't ask me to say that again. But yeah, that program.
I'll talk a little bit about each of them. Absolutely. The physical therapist assistant program from which Christine graduated with, they are in charge. They work under the supervision of a physical therapist, and they help patients quite literally get back on their feet. They help with the management of pain. They help patients get their independence back. And so they do God's work, I often say, particularly with pain management and independence. Did I cover that?
You did.
Did I say that
well.
pretty well? Okay.
God's work.
And the salary is about $57,000 a year. I mean, that's a very handsome salary. Again, a great return on the investment. The job outlook, they're expected to grow by 46% between 2010 and 2020, and that's very significant. And again, a reflection of our aging population.
Right.
So work will not be an issue for anyone with this degree. The radiologic technology program is these individuals perform diagnostic imaging and procedures such as X-rays, and they too, their salary range is about $63,000, and their job placement rates are great. Licensure pass rates are 100% consistently. The program, I believe, is around 30 years in existence. We've had a long-term program director, Jim Pronovo, who does an outstanding job of leading that program, and Antonio Santos, who is the clinical coordinator, is a very, very strong program.
Right.
And our students in that program find work in a variety of settings. Of course, the two city hospitals, Waterbury and St. Mary's. Many of our graduates from all of our programs staff those two hospitals.
Hold on, we have a caller for you.
Oh, okay.
Michael Regan, Medicare and You. How are you?
Good. How are you? I just wanted to say I'm so proud of them women because my granddaughter is going to the Naugatuck Valley College studying to be a nurse. And I says, you got to stick with it because I'll tell you, you have to love what you're doing with the people because even when I worked in convalescent homes, sometimes it could be a little stressful because sometimes some of the patients, are confused and don't want to be there and they're argumentative. But I said, sweetheart, you have to love what you're doing. So that's what we need, a lot of nurses and more doctors in this world because I'll tell you, that was a nice story that girl Chris said. I'm so proud of you, and you're not even a relative of mine, but I'm so proud of you to think that you're sticking with this. And I want to thank Michael Regan for having people like you on there because it's such a veritable show. So thank you, Michael, and God bless you, girls.
Have a good one. Good to hear you listening. Thanks so much.
Thank you.
Thank you.
All right.
Thank you. That was very nice.
Remember when you call in, always be HIPAA compliant. Try not to say any names. If you can say the first name, that's totally fine, but no last names. All right. Keep going. This is obviously...
Okay.
Thanks. That was nice. Good story. You got through to people. Good. Good.
So the radiologic technology program also has a good job outlook. Their employment rates will increase by 28% from 2010 to 2020. And again, their job placement rates are terrific. They have recently been successful in getting an articulation agreement for an advanced degree for their graduates, and that is with St. Vincent's. So we're very happy about that. And we also have a partnership, our radiology program, with Danbury Hospital.
I saw all your partnerships here.
Yeah, yeah.
And will you piggyback on that Bacchus Hospital merger with Hartford Hospital?
That I don't know yet. I don't know the answer.
They just
to that.
swallowed them up.
Yeah.
Yeah.
So I would presume that we would, yeah.
But your main two go-to hospitals are the good ones, Waterbury Hospital and St. Mary's.
Well, actually, and they are, because that's the community that we serve, but we have so many students that we do branch out. We like to give students in all of our programs exposure to not just the small community hospitals, but also large and major medical centers, and as well as rehabilitation settings. So we are at Gaylord Hospital with students in our respiratory program and our nursing program.
Fantastic place.
Yeah, it is a fantastic place. I could not agree more. We're, as I said, at the two city hospitals, but we're at small community hospitals such as Griffin, in Derby with a wonderful plane tree model. I don't know if you're familiar with Griffin.
Dr. Dobler, Kenneth Dobler.
Yes.
I know Griffin
great guy.
well.
I know him well,
I know
too. I was
Griffin
there with
very
students
well.
for a number of years, yeah. We also go to, we still call it St. Raphael's, but they've now merged
Yale,
with Yale.
I know,
so
but we all still do.
Right. So we have students at Yale and Charlotte Hungerford, and again, the radiology students, with the respiratory students, rather, are at Danbury Hospital. So we are spread all over the state.
And it appears that you do have like a network of really good connections, too, like Village of East Farms or The Hearth or Grace Flight, her organization. Like, you're placing your people in these places, I'm told.
Yeah, one of our newest affiliations will be with Bethel Healthcare.
That's Grace.
Yeah. And so we're very excited about that.
I grew up with her in Cheshire.
Oh, did you?
Great lady.
Yeah, it's a wonderful
Self-made,
place.
too.
Really, yeah.
Really impressed.
We're looking forward to it. It's a wonderful place.
Do
I
you
think it'll be
know
a good fit for
Amnesis?
us.
They're the largest hospice firm in the country. And they're always looking. My brother was a bigwig there before he sold out, but they're always asking me if I know quality. The long-term care market is here to stay. Mm-hmm. And we'll talk about that at the end of the show, but if you don't think so, if you can't afford a long-term care policy, it's the people like Christina that are really there taking care of your loved ones.
Sure.
And it's not a doctor. The doctors just come in to sign the charts. It's really Christina and her coworkers that are doing, the nurses, the LPNs, the radiology techs. They're doing all the work. Who put you in the MRI machine? Your people. It's very rare where you'll see a white coat doctor doing the actual work. It's your people.
Well, we work in collaboration.
Collaboration's a nice word.
With our physician colleagues, and we do work under their supervision. They certainly have much more
they have
education
to say.
than
No.
right.
I never bash doctors, especially not on this show, because they save lives.
That's
and I
right.
can't.
Absolutely.
I can just sell paper. So
Absolutely.
I do have a lot of respect for the medical field.
Our respiratory therapy program. Also,
Which is sold out, by the way.
Yes,
honestly, how deep is your waiting list? I heard it's like 20, 30 people, right?
It's deep.
All right.
Deep.
You're saying it. All right. We got to take a commercial break. Producer Tom's like looking for the cue cards. We'll take a commercial break, and we will be back in 2 minutes.